Hello. Today I will be talking about what are the risks of uncontrolled seizures. So in any patient who has uncontrolled seizures, the most common adverse effect is related to injuries. So when patients tend to have recurrent seizures, they can fall down, they can fracture, they can have head injuries, they can have various bruises in various parts of the bodies. The second adverse effect is that epilepsy is beyond seizures. So seizures is just the tip of the iceberg, but there are various broad aspects in epilepsy. So the other adverse effects in patients with long-term epilepsy is mainly psychiatric side effects. So psychiatric side effects may be because of epilepsy per se or the medications which they take. So this may be in the form of depression, anxiety, and patients can even have suicidal ideations. The other adverse effects of long-term uncontrolled seizures are mainly in terms of restriction of freedom of life. So as you know that people with epilepsy, they do not get a driving license, and also they have job restrictions as to what job they get, and employment in certain sectors like, for example, like in the airline industry, etc. is restricted for this group of patients. Apart from that, people with long-standing epilepsy, especially women, they have issues related to marriage. So getting a proper match and getting married due to various social stigma associated with epilepsy is seen in these patients. Apart from that, these people with epilepsy tend to have significant financial burden. So mainly this financial burden due to various reasons, right from getting the right job and also the cost of medications. So they have to be on medications, some people for minimum of 3 years, and some have to take lifelong. So in the view of this, they spend a lot of their money on using these medications. And apart from that, the most deadly complication of uncontrolled seizures is SUDEP, which stands for sudden uncontrolled death in epilepsy patients.